Imagine a world where a new virus, Mpox, is spreading faster than you can blink. From its origins in Africa to its unexpected arrival in Europe, the world is on high alert. This isn't just another health scare. It's a wake-up call, echoing the panic and chaos of the COVID-19 pandemic. In this video, we'll uncover the truth about Mpox, why it matters now, and how it could reshape global health. Stay tuned to find out how you can stay ahead of this new threat and protect your loved ones. Don't let fear catch you off guard. Get the facts right here. Chapter 1: The Rise of Mpox, from Africa to the World. Mpox, a virus once contained within the borders of a few African nations, has now emerged as a global concern. The World Health Organization, WHO, recently declared Mpox a global emergency, echoing the early days of the COVID-19 pandemic. This declaration has sparked a wave of concern worldwide, especially as the first case has now been confirmed in Sweden. To understand the seriousness of this situation, it's crucial to delve into the origins and nature of Mpox. Mpox, also known as monkeypox, is not a new virus. It was first identified in 1958 in research monkeys, hence the name. However, the first human case was recorded in 1970 in the Democratic Republic of Congo. The virus primarily spreads through close contact with an infected person or animal, or through contaminated materials. Symptoms of Mpox are similar to smallpox but generally less severe. They include fever, rash, and swollen lymph nodes, which can lead to a range of medical complications. For decades, Mpox remained largely contained within Central and West Africa, with only occasional cases reported outside these regions. However, the rapid globalization and increased human interaction have created opportunities for the virus to spread beyond its traditional boundaries. The recent surge in cases, particularly in Europe and North America, has brought Mpox to the forefront of global health discussions. The WHO's declaration of Mpox as a global emergency is a significant step that signals the seriousness of this virus. It's a reminder of how quickly a localized health issue can become a global threat in our interconnected world. This declaration isn't just a label. It's a call to action for governments, healthcare organizations, and the public to take the necessary steps to prevent Mpox from becoming a pandemic. In drawing parallels to the early stages of COVID-19, we are reminded of how critical it is to act swiftly and decisively. During the initial outbreak of COVID-19, delays in recognizing the severity of the situation contributed to its rapid spread. With Mpox, we have the advantage of hindsight and the opportunity to apply the lessons learned to prevent a similar scenario. As the world watches closely, the rise of Mpox serves as a stark reminder that global health is a shared responsibility. The steps we take now will determine whether Mpox becomes a widespread crisis or a contained outbreak. Chapter 2: WHO's Declaration: What it means for the world. The World Health Organization's declaration of Mpox as a global emergency is a pivotal moment in the fight against this emerging virus. When the WHO makes such a declaration, it signals to the entire world that a serious health threat has the potential to escalate beyond control if not managed effectively. This announcement is not made lightly and is reserved for situations where coordinated international action is urgently required. To understand the gravity of this declaration, it's essential to revisit the criteria that WHO uses when assessing whether an outbreak qualifies as a global emergency. The key factors include the severity of the disease, its ability to spread across borders, and the potential for it to overwhelm healthcare systems. When these criteria are met, As with Mpox, it means the virus poses a significant risk to public health worldwide. The implications of this declaration are far-reaching. First and foremost, it prompts countries around the globe to intensify their surveillance and response efforts. Governments are now more likely to allocate resources toward containing Mpox, including funding for research, public health campaigns, and the distribution of medical supplies. In many cases, travel advisories may be issued, and screenings at borders could become more stringent to prevent the further spread of the virus. Furthermore, the WHO's declaration also serves as a wake-up call for the general public. It emphasizes the importance of staying informed and following public health guidelines. During the COVID-19 pandemic, we witnessed how misinformation and complacency contributed to the virus's spread. This time, with Mpox, the world has the opportunity to respond more effectively by learning from past mistakes. In addition to governmental and public responses, the declaration also galvanizes the scientific community. Researchers and pharmaceutical companies are now under increased pressure to develop effective treatments and vaccines for Mpox. The urgency of the situation could accelerate the timeline for clinical trials and approvals, similar to what we saw with the rapid development of COVID-19 vaccines. Ultimately, the WHO's declaration of Mpox as a global emergency is a critical step in mobilizing international resources and attention. It underscores the need for a unified global response to prevent the virus from spiraling out of control. The world is now on high alert, and how we respond to this declaration will shape the trajectory of Mpox in the coming months. As we've learned from past pandemics, early and decisive action is crucial in preventing widespread devastation. Chapter 3: Containment Efforts. Learning from the past. As Mpox emerges as a global threat, containment efforts have become the focal point of international health strategies. Drawing lessons from the COVID-19 pandemic, world leaders and health experts are working to prevent the mistakes of the past from repeating. The rapid spread of COVID-19 exposed critical gaps in global preparedness and response, providing valuable insights into how to better manage a potential Mpox outbreak. The first step in containment is the rapid identification and isolation of cases. During the early days of COVID-19, delays in testing and reporting allowed the virus to spread undetected, leading to widespread community transmission. Learning from this, countries are now ramping up testing capabilities for Mpox, aiming to identify cases as quickly as possible. Rapid testing not only helps in diagnosing infected individuals, but also in tracing their contacts, which is essential for breaking the chain of transmission. Another key element of containment is public awareness and education. During the COVID-19 pandemic, misinformation spread as quickly as the virus itself, leading to confusion and panic. Governments and health organizations are now focusing on clear, consistent communication about Mpox, ensuring that the public understands the risks and necessary precautions. Social media platforms, which played a significant role in the dissemination of COVID-19 information, are being leveraged to spread accurate and timely updates on Mpox. Quarantine and isolation measures are also being re-evaluated based on past experiences. While these measures are crucial in containing the spread of infectious diseases, the prolonged lockdowns during COVID-19 led to significant economic and psychological impacts. For Mpox, authorities are seeking to balance public health needs with the socio-economic realities of affected regions. Targeted quarantines and localized restrictions, rather than blanket lockdowns, are being considered as more effective strategies. International cooperation is another critical factor in containment efforts. The COVID-19 pandemic highlighted the importance of global solidarity, as no country is immune to the effects of a pandemic. With Mpox, the international community is working more closely than ever before, sharing data, resources, and expertise. Initiatives like the global sharing of vaccines, which became a contentious issue during COVID-19, are now being addressed more proactively to ensure equitable access to Mpox vaccines and treatments. In addition to these measures, there is a heightened focus on research and development. The scientific community is accelerating efforts to understand Mpox better, from its transmission dynamics to potential mutations. Research is also being directed toward developing more effective treatments and vaccines, with the goal of preventing Mpox from reaching pandemic levels. Ultimately, the success of these containment efforts depends on the lessons learned from past pandemics. By acting swiftly, communicating effectively, and cooperating globally, the world stands a better chance of controlling the spread of Mpox before it becomes an unmanageable crisis. The road ahead is challenging, but with the right strategies in place, we can hope to avert the devastating consequences experienced during COVID-19. Chapter 4: The Public's Role: Staying Informed and Safe. In the fight against Mpox, the public's role is crucial. While governments and health organizations are working tirelessly to contain the virus, individual actions can significantly impact the outcome. The lessons from the COVID-19 pandemic underscore the importance of staying informed, practicing preventive measures, and contributing to the collective effort to halt the spread of Mpox. The first step for everyone is staying informed through reliable sources. During the COVID-19 pandemic, misinformation and rumors spread like wildfire, leading to confusion, fear, and, in some cases, dangerous behavior. With Mpox, it's essential to rely on trusted health organizations like the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, for updates. These organizations provide accurate, up-to-date information on the virus's spread, symptoms, and preventive measures. By staying informed, individuals can make educated decisions that protect themselves and their communities. Practicing good hygiene is another critical aspect of preventing the spread of Mpox. Similar to COVID-19, Mpox spreads through close contact, making personal hygiene practices essential. Regular hand washing with soap and water, using hand sanitizer, and avoiding touching the face are simple yet effective ways to reduce the risk of infection. Additionally, people should be mindful of maintaining physical distance in crowded places and wearing masks in situations where the risk of transmission is higher. Understanding the symptoms of Mpox is also vital. Early detection can prevent further spread and ensure that those infected receive timely medical care. The symptoms of Mpox include fever, rash, and swollen lymph nodes, which can resemble those of other viral infections. If someone experiences these symptoms, especially after traveling to or having contact with individuals from affected regions, it's important to seek medical advice immediately. Early diagnosis and isolation are key to preventing the virus from spreading further. Furthermore, it's important to avoid contributing to stigma and discrimination. During the COVID-19 pandemic, certain communities faced unfair blame and prejudice, which hindered global efforts to combat the virus. With Mpox, it's crucial to focus on solidarity and empathy, understanding that viruses do not discriminate based on nationality or ethnicity. Supporting those affected and fostering a sense of community will strengthen the collective response to Mpox. Lastly, individuals can contribute by sharing accurate information and debunking myths. Social media platforms can be powerful tools for spreading awareness, but they can also be sources of misinformation. By sharing reliable information and encouraging others to follow public health guidelines, everyone can play a part in preventing Mpox from becoming a global crisis. In conclusion, the public's role in combating Mpox is pivotal. By staying informed, practicing preventive measures, and fostering a sense of community, we can collectively work to contain the virus and protect our health and the well-being of others. Chapter 5: Preparing for the Future, Strengthening Global Health Security. As the world grapples with the emergence of Mpox, it's clear that preparing for the future is more critical than ever. The COVID-19 pandemic served as a wake-up call, exposing vulnerabilities in global health systems and highlighting the need for robust preparedness strategies. With Mpox now on the rise, strengthening global health security has become a top priority to prevent future pandemics and ensure a rapid, coordinated response to emerging threats. One of the key lessons from the COVID-19 pandemic is the importance of investing in public health infrastructure. Many countries struggled to cope with the sudden surge in COVID-19 cases due to underfunded healthcare systems, inadequate testing facilities, and a lack of medical supplies. To avoid a repeat with Mpox or any future outbreaks, governments must prioritize funding for health services, ensuring they are well equipped to handle emergencies. This includes building and maintaining stockpiles of essential medical supplies, improving testing and diagnostic capabilities, and training healthcare workers to respond to infectious diseases swiftly. Global cooperation is another crucial element in strengthening health security. The interconnected nature of today's world means that a health crisis in one region can quickly become a global issue. The rapid spread of Mpox from Africa to Europe underscores the need for international collaboration. By sharing data, resources, and expertise, countries can work together to detect and contain outbreaks before they spiral out of control. Organizations like the WHO play a vital role in facilitating this cooperation, ensuring that information flows freely and that resources are allocated where they are needed most. Innovation in medical research is also a cornerstone of future preparedness. The development of vaccines and treatments for COVID-19 in record time was a testament to the power of scientific collaboration and innovation. To tackle Mpox and other emerging diseases, continued investment in research and development is essential. This includes funding for vaccine research, antiviral drugs, and new diagnostic tools that can help detect and treat infections quickly. Finally, public education and awareness must be a continuous effort. A well-informed public is a powerful tool in the fight against infectious diseases. Governments and health organizations should continue to engage communities, providing them with the knowledge and resources needed to protect themselves and others. In conclusion, strengthening global health security is not just about responding to the current Mpox threat. It's about preparing for whatever comes next. By investing in healthcare infrastructure, fostering international cooperation, advancing medical research, and educating the public, the world can build a more resilient future capable of withstanding the next pandemic. Summary and call to action. As we face the emergence of Mpox as a global health threat, it's essential to remember the lessons of the past while forging a path forward. In this video, we've explored the origins of Mpox, its spread from Africa to other parts of the world, and the concerted efforts being made to contain the virus. By learning from the COVID-19 pandemic, we've seen how rapid identification, public awareness, and international cooperation are vital to preventing another global crisis. We've also highlighted the critical role that each of us plays in this fight. Staying informed, practicing preventive measures, and supporting global health initiatives are all actions we can take to contribute to the containment of Mpox. The world is more prepared than ever before, with accelerated vaccine development, enhanced surveillance systems, and a renewed focus on public health education. Together, these efforts give us hope that we can control this virus before it reaches pandemic proportions. But this battle requires collective action. We must all do our part by following health guidelines, supporting accurate information dissemination, and remaining vigilant. Share this video with your friends and family to spread awareness about Mpox and how we can work together to prevent its spread. Your engagement is crucial. Like this video, subscribe to our channel, and hit the notification bell to stay updated on the latest developments. Let's stand united in the fight against Mpox and protect our global community. Together, we can make a difference. Stay safe, stay informed, and take action. Thank you for joining me on this deep dive into the Mpox outbreak. Your awareness and action are crucial as we navigate this global health challenge. Stay tuned for more updates and in-depth analyses on current events. Hit the subscribe button, and don't miss out on our future videos. I appreciate your support and hope you found this information valuable. Have a great day, and stay safe.